I do my hand hygiene, and I would also take a look at my patient's documentation and make sure that I'm here for the right reason and that I know any background information that I needed. All right. Hi, Sarah.
Hello.
How are you feeling today?
I'm feeling okay. I'm a little tired, but I'm doing all right. Better than yesterday.
Okay, good. So my name's Darby. I'll be your nurse today. We're just going to do an abdominal assessment, and I'll continue about that in a little bit. But could I get your full name and your date of birth?
Yeah, my name's Sarah, and 6574.
Perfect. All right. So because of your surgery that you just got out of, we're just going to do a focused assessment, kind of like the one we did when you first got here, but it's just going to be focusing on your abdomen and kind of the pain there,
Okay.
making sure that everything's working good there.
That sounds good.
Do you have any questions at all for me?
I don't think I have any right now, but I'll let you know if I do.
All right. And are you in a comfortable position?
Could you maybe rearrange my pillow a little bit to make it more comfortable?
All right. How's that for you, Sarah?
That's a lot better.
A
Thank
lot
you.
better? Yes, of course. And do you need to go to the bathroom before we start?
I don't think so. I should be okay.
All right, perfect. If you need to while we're going through it, just let me know and we'll bring you to the bathroom.
All right. Thank you.
Yes. All right, so for the abdominal assessment, I'll take your vital signs first and we'll assess your pain. And then we'll take a look at your abdomen and kind of inspect it. Take a look at that, make sure your incision site is healing properly. And then we'll also feel around and we'll listen as well.
Sounds good.
All right, do you have any questions for me?
Not right now.
All right, and so have you had a bowel movement since your last surgery?
I wish, but no.
Okay, we will definitely make sure you have one before we discharge you, because that's very important.
Okay.
And have you been able to urinate at all?
Yes.
All right, perfect. And is it pain in your incision site, your abdomen, or kind of everywhere?
It's kind of just everywhere, but especially on my incision site.
Okay, that's totally normal. And what kind of pain is it?
Kind of just like numbing a little bit.
Okay. And on a scale of 0 to 10, it kind of comes and goes?
Yeah.
Okay. On a scale of 0 to 10, 10 being the worst pain you've ever felt, where would you rank this?
Maybe like a 6 or 7.
A 6 or 7? Okay.
Yeah, it's getting better. Yesterday was a lot worse.
Okay, that's good to hear. I'm very glad. Is it just staying in your abdomen, or is it kind of spreading and radiating?
It's just kind of in my abdomen.
Just in your abdomen? Okay. And is it, you said it kind of comes and goes?
Yeah.
Do you feel pain always, or it just kind of gets worse every once in a while?
It'll get worse, but usually if I'm resting, sometimes that will help.
Your resting helps? Okay, perfect. And isn't there anything that makes it worse?
I don't know necessarily.
Okay. All right, perfect. So I'll take your vital signs before we start their actual abdomen assessment.
Okay.
So I'll take your pulse, I'll take your blood pressure, I'll count respirations, I'll check O2, and I'll check the temperature. So all of your vital signs are good, Sarah, so we are all good to go.
Yay.
All right. So I'm just going to lift this up. And are you still good and not needing to use the bathroom?
No, I shouldn't need to.
All right. All right, and so during this whole assessment, if you ever feel uncomfortable, if you need me to stop for anything, let me know and we'll do that right away.
Okay.
All right, so first I'm just going to inspect. So I'm looking for discoloration. I'm noticing scars, bruising, anything like that, and anything that might cause me to worry.
Okay.
All right, and so I'll have you take a deep breath. All right, and so I'm just checking for lumps. So if there was a lump that I saw while you were breathing, that maybe would be something we take a look at.
Okay.
But I don't see anything. Could you do one more? All right, perfect. So I'm going to take a listen first. I'm expecting your bowel sounds to be kind of hypoactive, which means that they're not really active right now.
Okay.
And that's just because of the surgery and the kind of medication we gave you to put you under.
Awesome.
So that is totally normal. All right, Sarah, they're a little hypoactive, which,
Okay.
like I said, as kind of expected, so nothing to worry about there.
Okay.
All right, so now I'm going to palpate, and that's just kind of feeling around for anything that might raise concern.
Mhm.
If you feel any tenderness or any pain, let me know, and we'll make sure we keep track of that.
Okay. Sounds good. Ooh, that's a little tender.
That's a little tender? Okay.
Yeah, that kind of hurts.
It kind of hurts? Okay. I will try to be as gentle as possible.
Ooh.
Alrighty. So you are all good with the assessment.
Mhm.
Everything looked normal, everything felt normal. Your incision site is dry, intact, and it's healing properly, so that's really good.
Good.
Yeah. Alright. Is there anything else I can do for you?
I'm a little cold. Could I get another blanket?
Of course, I'll get you another blanket after this.
Thank you.
And are you in a comfortable position?
Yes.
Alright, perfect. Just I'll lower your bed, and I'll give you back your call light. And so if you need anything, just call us, and I'll take a look and see if we can give you any more pain medication now.
Okay.
Try to get that down. So I'll check your chart.
Okay, thank you.
Alright, this is when I would document what care I gave and the findings I found.